Hi everyone, welcome to our channel, Thai Food for Tater. I'm Alicia. I just wanted to post an update on some of the medical stuff. So I know earlier on, like last year, I had those larger or longer videos on my treatment, and then kind of since then I've posted like updates periodically. And the last one I posted like a month ago or so was talking about the bullshit that's been going on with the new insurance and just the drama of navigating the healthcare system in this country with cancer or recovering from cancer. And some stuff happened like right after I posted that video. Like 2 days later, I had seen my oncologist, and I was like, I don't even want to talk about it. I was so angry. And luckily it all kind of resolved itself. Basically what happened was so this should be like a 2 minute story. We'll see if I keep it to 2 minutes. So I mentioned before that there was all this drama for like an entire semester, months and months of trying to get settled in with this new insurance and getting a new oncologist, because the oncologist I had been seeing for years through a certain facility, like that facility didn't take the insurance I now had. It was a whole thing. And like I said, I went through all of that on the previous update video. So it was already just like, drama. It ate up way too much of my fucking life that whole semester, and finally seemed to get resolution in when I did get my new oncologist, even after waiting for forever and having this crazy delay in my medications and my monthly treatments. That she seemed amazing, and so I was like, okay, maybe it was all kind of worth it. She seems great. And there has been a delay in some of my treatment, but she and I kind of talked about that. She's like, it's not the end of the world. We can adjust this, we can adjust that. She's like, we might have in 6 months decided to change your dosage and or frequency anyway based on XYZ. She's like, so like don't panic, essentially. Which like I really needed to hear. Anyway, so we thought we'd had this resolved. She's like, we're going to keep you on the monthly shot for now, and which that's the thing that I had missed for a few months, and they got me back on it. And she's like, and we'll keep you on the medication you're currently on. We'll reevaluate in a few months, as is normal, to kind of maybe adjust medications and stuff. So I go in the following month to get my shot, and because it's been resolved, because I'd gotten the shot the month before. So I go in to get my shot, thinking this is already like fixed and resolved. And I'm talking to her, and she's like, you're gonna hate me. And I'm like, why? I'm like, I don't. But she was like, there is still an issue with the monthly shot. And I was like, what do you mean? I got it last month. I thought it was finally resolved. She's like, well, apparently not. Basically what happened, she told me, was that the reason it took so long for them to get that initial authorization was because the dosage that they wanted to give me, apparently my insurance had a problem with, even though it's one I have in terms of breast cancer, I have one of the most common types, and the medication that I was on is like standard treatment. It's not like some experimental thing, or they were giving me like this really crazy dosage of something. Like, no, it was like very standard care. And so she was like, I don't know. Like, they were giving us this hard time about the dosage. She's like, but I don't understand. Like, it's a standard dosage. Plus, like, also, like, it's the fucking doctor's opinion as to what dosage I should get. It should be up to the fucking insurance, like, what medications I should be on, or how much I should be on, or how often I should be on it. That's up to the doctor, And so she's like, yeah, they originally, for the one that you had last month, they authorized it after we fought with him on it. She's like, now they're just basically saying they won't authorize us to give you that medication with this dosage. She's like, so we have a few options. She's like, we can try another medication. We can give you this medication at a different dosage. We can just not do a monthly shot anymore. And she was like, now it could be that, she's like, maybe this was kind of meant to be. She's like, because she had already said, in 6 months, we probably would have reevaluated my treatment course, because she said, for my type and my age, that keeping me on the same exact medication for like 10 years might not give me the best result in the end. That kind of changing it up actually can often help. Apparently, she said there's some data to back that up. So I was like, okay. She's like, so this might have just kind of jump started us into just changing it anyway. She's like, the last thing you need as a recovering cancer patient is more stress in your life. And she's like, she was pissed. I think she was probably more pissed than I was about all this bullshit with the insurance for months now. She's like, the fact that they're doing this, first of all, doesn't make sense given that it's a standard course of treatment. She's like, but also like they're not taking into consideration how stressful this is on patients, and like this is no fucking surprise. Like we all know this is what happens. It's outrageous. And so she was right. It was like, I have been spending all this time on these forms and phone calls and and like trying to get these appointments, and it was just like it became like almost a semi full-time job, like getting all this stuff sorted out. And so we were talking, and she, and she's like, look, why don't we just do no more monthly shop? And she's like, that way we just save ourselves the headache of the insurance. They're not gonna, I was like, okay. She's like, and we're gonna change your monthly or your daily pill. We'll change it to another medication I think is gonna be more appropriate for you. For now, we can reevaluate in like a year. And I was like, okay. And so then we talked about the consequences of me changing my medication. And so I talked about this in previous videos that I was in menopause, like artificially like induced, but like, because of the medication. And she said, given that with that break that I'd had in the monthly shots and now changing the medication, that my body will she said it's like 50-50 that my body can go back into not menopause, like go back into menstruating. She's like, but we'll see. She's like, because with chemo and everything else that happened to your body, maybe not. We'll see. So like, I'm not looking forward to that. I think I've mentioned this in previous videos. It's been a nice convenience not having to worry about having a period all the time. But also I don't mind it at all. Like I'm a female. I embrace that. I find it to be a beautiful thing, beautiful part of being a female, these bodily processes. So that's fine. It's just all of it. It's just like one of those things like that happens in life where you're like, I didn't mind necessarily like this happened this way or that way, but the fact that I had to make these decisions based on someone else's bullshit is like the problem. You know what I mean? So it's like, okay, in the end, me changing my medications might have been something we did anyway, and it might even work out in my favor. But the fact that we had to make these decisions simply because 80% because it was just drama with the insurance is like crazy. Because like, what if it's not? What if it ends up being that? Because I even brought this up. I was like, well, what if I'm the exception to the rule, which happens a lot with my fucking treatment, and that, being on the other medication was like vital to my cancer not reoccurring, and it reoccurs. And then we're like, damn it, we should have just kept fighting with the insurance. And she's like, you're right. She's like, so I'll leave it up to you. And I was like, well, you're the medical professional. Like you're the one who went to many years of medical school and training to, she's like, I think we should do it for like 6 months and then just kind of see how you're doing. And we can do blood work and do some imaging and stuff. And also the other benefit too is that I'm not going to have all those horrible, well, at least most of them, those horrible side effects, like the severe joint pain, where I was on like all these pain meds for walking around like an old lady, like an 80-year-old woman, because my joints just wouldn't function. So I've switched the medications. That's been about a month, and I can tell you I'm already feeling like, I would say 50 to 60% better in terms of my joints, like a noticeable huge difference. I'm already feeling like I just have a little more energy because of that. I'm in less pain. I can move about more easily. So I'm like, okay, that's nice, So, I mean, that's kind of the story. Just a quick update. Like I said, when this all happened, like literally like 2 days after I posted that previous video, and I was like, I don't even want to talk about it right now. And I just posted a video, I'll wait. And I was thinking about it earlier. I'm like, I need to talk about that. It was just such bullshit. And I know in the previous video, I didn't mention which insurance companies I had. Those of you who know me personally, you know which one. And it's just like, it irks me so much. Like I can't even, like multiple levels that it's just bullshit. But okay, so that's the update for now. I'll probably post one again in a couple months. I'm going to be getting some imaging done here soon, I think, and I'll give you an update on anything else that happens. And I'll see you guys on the next one.